guys, how are you?
I'm good.
Hey, I heard about this place they just opened up and they have tanning beds, and I was thinking since we're gonna be in the summer, we should go get tans.
Alright, let's go.
No, you guys, hey, no. Do you see what happened to me?
What happened?
My doctor diagnosed me with basal cell carcinoma.
Oh my god, I don't want to go anymore.
I'm gonna go.
You got that from tanning beds?
Yes, this is from tanning bed. I've been doing this for like years, and this is what I got for just because of this.
Oh my
This is
god.
what I got.
I don't want that.
I don't want that either.
Yeah, please. So no, don't go to tanning bed.
Okay.
Alright.
Hi, my name is Justine.
My name is Simone.
My name is Kani,
And I'm Yesenia.
and today we'll be presenting basal cell carcinoma. Basal cell carcinoma is one type of cancer that are very common in the U.S. This last year there was 2.8 million cases were diagnosed with this skin cancer. And what is basal cell carcinoma? These cancer appear abnormal, uncontrolled growth, or lesion that arise in the skin basal cell, which is the deepest layer of the epidermis. Basal cell carcinoma appear sign as an open sore, which is red and crusty, and sometimes it can be bleed. They will heal back and it will bleed again, over and over. The second sign are the reddish patch or the irritated area. This is appear on the chest, shoulder, and arms. It may also be itchy and hurt. The third sign are the shiny bump or nodule that appear clearly or pink or white. And so also on the dark hair people, it can be confused with like tan or dark bump on their skin. And the fourth sign are the pink growth, which appear like is about to bleed, but it just like appear pink and have like a red vessel, blood vessel on the surface. And the last sign are the scar-like area is appear like a normal scar on your skin, but the basal cell carcinoma appear larger than on the surface.
Some of the causes to this type of cancer are long-term sun exposure over a lifetime. Another one is infrequent intense exposure, which means that you're in the sun for too long in maybe several different occasions. It also occurs, so what happens in this type of cancer is when the skin basal develops a mutation in its DNA, and then this mutation causes the cell to multiply rapidly and non-stop. The abnormal cells continue to accumulate and eventually form a cancerous type of tumor. And some of the risk factors that are associated with this type of cancer are, like I said, chronic sun exposure. If you have like very fair skin, or if you're over the age of 50, going back to the long-term sun exposure over a lifetime, usually whenever you're over the age of 50, you're more prone to get it. Also, another risk factor is having a history of skin cancers, and also exposure to arsenic, which is a type of toxin to the skin. So there are two different types of rays that can cause this type of cancer. We have the UVA and the UVB. The UVA usually comes from tanning beds, and the UVB is usually from sun exposure. UVA rays usually penetrate the skin more deeply into the dermis, and they also damage the skin cells, the keratinocytes, and in the basal cell layer. The UVA ray is also, like I said, comes from tanning beds. And in the UVB rays, they usually cause more of a sunburn is what you usually see, but you can get this type of cancer from this type of ray because over time and constant exposure, it could develop into a different type of cancer. They also tend to damage the skin surface layer on the epidermis, and exposure to UVB rays is more common since they are transmitted through sunlight.
So I'm going to be talking about the treatments. There are 4 types of treatments. There are medications, medical procedures, surgeries, and visits to specialists afterwards. For the medications, you can use topical anti-tumor medications that are prescribed, and these medications kill cancer cells that are on the skin, like the ones suggested. And the second, medications and chemotherapies are used to kill cells that are growing and multiplying too quickly. And the second is tissue scarring, and this is where a surgical instrument called a curette is used to remove the tissue by scraping or scooping it off. And then the last is Moggs surgery, which is a surgical removal of the skin layer by layer until there's only healthy tissues left. The third is surgery. Electrosurgery is where electric currents are used to cut the tissue and control the bleeding during the surgery. There's also wide local excision, which is a surgical removal of. And lastly, visiting specialists. You could visit a plastic surgeon after your treatments just to reconstruct the damaged body parts that occur with the treatments. You can also visit the dermatologist to focus on the disorders of the skin, nails, and hair. The prognosis for basal cell carcinoma is very good, with 100% of survival rate for the cases that have not spreaded to other places. It is a malignant neoplasm, but it rarely spreads, and when it does spread, it spreads to the lymph nodes, the lungs, and the bones. And although it's curative in 95% of its cases, it may reoccur in the first year and develop in new places. So regular skin screenings are suggested.
I'm going to talk about the 3 current research that I looked up. The first one I'm going to talk about is the cryotherapy. The cryotherapy is a technique that uses an extreme cold liquid to freeze the lesions and rethawing the process. Usually it's being used by liquid nitrogen. There were 3 cases that used cryotherapy. The patients were 3 senior citizens that were diagnosed BCC, which is basal cell carcinoma. What they do with the procedure is use a liquid nitrogen and a cotton swab and then apply it to the lesion area. They applied it daily for 5 to 7 days. The doctors have to look it up and see in their side effects for the patients. They have any headaches or feel nausea or etc. As a result, the lesions have disappeared. There were no side effects at all. So they consider it as an alternative treatment for a patient that have BCC that is inoperable and it's difficult to remove it during surgery. However, since it's not considered as a treatment for every one of them, it should be selected to other patients. The next thing we're talking about trichloric acetic acid. This is for the patients that has no money for surgery, that can afford it at all. So what they do is, for the purpose, is for the choice of therapy for a low case of BCC. So what they do in the clinical trial, they use a patient. They test one patient that has a BCC right here, right under the ears right here. So they use the TCA acid, which is trichloric acetic acid. They apply it in that area with a toothpick, and they apply it once a week for 4 weeks. When they apply it, you see the result in the picture right here. See the first one, how it looks right here. Second time will be the one that first applied. After the week, it will freeze and take the lesion, the black off. As a result, the lesion has disappeared, and it's not there anymore. So in conclusion, the TCA acid was safe and effective for choice of therapy for people that don't have a lot of money that you can use as a cream. For the last current research I'm going to talk about is a polyphenol. This is a natural herbal treatment for prevention, which this study has been going on for 11 years. So what you can do is drink the black tea. Black tea has a component of polyphenol, argivigamine, and theoflavin. Since we're going to talk about polyphenol, let's talk about it. So polyphenol is an antioxidant and an anti-inflammatory. It reduces UV ray and inflammation. It prevents immune suppression and DNA damages. It promotes cell death and repair. As a result, these current research, we're still looking for more treatments for basal cell carcinoma. We can give more ideas, and people have more ideas than you see. They're still looking for more treatments for BCC for people who can afford it, who can prevent it, can get rid of it as soon as possible. And here is our works cited page. These are the resources that our group found information about basal cell carcinoma. Thank you for watching.